Hi guys, Dr. Jessie here from the Doctors of Physical Therapy. Today we're going to talk about sciatic nerve glides. All of our nerves in our body come from our spinal canal and they run all the way down our body. Our sciatic nerve comes right from our lower spine. It runs all the way down into different tributaries that actually go all the way down into our toes. So a lot of times we'll have people coming in and saying, I have this pain that comes from here and it goes all the way down to thigh, knee, shin, toes, whatever. And it's this numbness, tingling, or it's this burning sensation, or this ache, or this is radiating pain. Oftentimes that's due to what's called sciatic nerve entrapment. All of our nerves in our body run through certain tracts throughout our body, and they run through certain tissues. And there's spots along the places they run where that nerve can get bound up or it can get adhered. And so what happens when that happens is that we see neural inflammation and oftentimes pain with it, or that tingling sensation with it. So what happens is nerves do not like to be stretched. They do not like to have any sort of adhesions. They like to be able to glide nicely through the tracks in which they're supposed to run from our spine all the way down to wherever they're supposed to terminate. So what we're going to go over today is what's called a sciatic nerve glide, which is going to help that nerve glide within the tract it's supposed to go, as opposed to getting bound up or caught anywhere along the way. So what that's going to look like is you're going to come onto your back here. You're going to shot. You're going to bring one leg up a little bit here, and from here you're going to point toes up, and then leg's going to come up. Then toes point down, leg comes down, up and down. It's a nice fluid movement, up and down. And all we're doing is we're gliding, or you can think of it as flossing, that sciatic nerve through the length it's supposed to go, trying to get it to free up from any adhesions that might be pinning it down along the way. Now, nerves, like I said, do not like to be stretched. They like to be glided. So if you're getting towards this end range and feeling like it's a lot of a stretch, or you're feeling a lot of your symptoms, back it off from there. Nerves are sensitive and they can easily get irritated if we bring them into too far of a stretch, or if we bring them past the range that they don't like. And so the idea is to just maintain a pain-free and a symptom-free range that doesn't feel much of anything other than like you're moving your leg up and down, up and down. While this doesn't feel like it's much of an exercise, this will actually help get that nerve to start having the mobility it's supposed to have and be able to move with you as you move your body, therefore decreasing the symptoms that you're having when you're doing things like possibly sitting or walking or running or any things you're doing. So give that a try 10 to 15 times, a couple times a day, and let us know, as always, if you have any questions at the Doctors of Physical Therapy. Thanks.